What the heck is actually going on with our bodies as we age? Why does pain seem to pop up? Why do we get injured so much more frequently? And why do all these like imbalances and weird things happen? Like our knees start hurting or our hips or oh my gosh, the lower back thing. Today, I've got the fitness doctor. He is the go-to expert here, Robbie Stahl. I can't wait to dive into this midlife conversation. Robbie, we need help. We need a lot of help here.
Let's do it.
So I got to tell you, when I met Robbie, he told me that he does anti-aging fitness for people over 50. And I'm looking at him and I'm like, are you even close to 50? What do you mean you do anti-aging 50, fitness over 50? The more I talk to him, the more I realize how flipping knowledgeable he is. I love his focus. He is correcting people, getting them out of pain, helping them be much more functional in life, which is truly the key to longevity. So Robbie, I've got a lot of questions for you, but I want to just start with just a little brief intro. Can you just share a little bit about your background and how this even became your topic of interest?
Yes, I will give you a big background in the shortest amount of time and interesting as I possibly can. Ready? Here
Great.
we go. Read my first exercise physiology textbook when I was 12. Started lifting weights around 8 years old, having no idea what I'm doing. Had a brother 9 years older, sister 7 years older. They were both total gym goers, so I got this natural passion from a very young age. Read my first literally university exercise physiology textbook when I was 12. I had this huge passion. Not a great student. I had a few classes I had failed through my schooling, but guess what? You'd find me in the library studying everything from psychology to nutrition to the endocrine system to biomechanics. I just had this natural passion. Went to school to be a PT, doctor in PT. Also quite interesting, back up just a step, in high school, I had all kinds of athletes, female and male athletes. I had the girls in school, like they'd start developing their legs and their butt muscles, and then other girls would come to me and want me to write their programs for them. So like this was my youth. It was always a passion, and went to school to be a physical therapist, doctor in physical therapy.
Mhm.
And out of school, I decided, you know what, I really want to focus in fitness. And I did. I
Yeah.
trained some of the best athletes in the world, figure, physique athletes, Navy SEALs, pretty much every sport, football, baseball, soccer, like you name it, tennis. And I ended up realizing that after having 3 clients get divorced after bodybuilding shows, I
Oh,
realized, you know what? That's not what fitness is about.
yeah.
It's about so much more than that. And you know what? It really does seem like that most of the people, the more fit they get, the more broken they get. And when
Mm.
you're really inside the fitness circle, you will actually know that, yeah, you know what? That's actually pretty true. And so I started looking at the research heavily with one of my colleagues who's a co-creator in our systems, Dr. Trent Nessler.
Mhm.
And he's done over 100,000 3D movement assessments on every detail of what happens with the body mechanics as we move. And we've done literally 5 year research study, over a million case subjects, looking at what is the ideal functionality of the human body, where does it go wrong, why do people get injured, and most of the things that go wrong with us, it's not impact injuries. These are all
Okay.
overuse injuries. So long story short, I wanted to develop literally the world's best system for optimizing your body functionality instead of most of the knucklehead stuff that
Uh-huh.
everybody else and I used to do in fitness and most people are still doing. So that's pretty much
Yeah.
track.
No, this is so good. I have so many questions for you. And by the way, y'all, if you don't know this about me, if you've not followed me on social, I am that person who had multiple injuries. I am that person who had a disc rupture and had all these things go wrong, probably really stemming back to some of the stuff that you teach here. So I've got a lot of questions. I'm just going to start firing them at you and you help us here. Like, first of all, do we all have to age and be in pain?
Absolutely not.
Okay.
No.
What are we doing wrong? Why are so many in pain?
I think there's multiple aspects to it. One part of it is mind, energy, emotions. Okay.
Okay.
Part of it is definitely nutritional in our lifestyle and things around us. And part of it is mechanical. And it's really all three. Like, regardless of how messed up you feel or
Mhm.
how big your issues are, tackling all three of those is going to make like a wow, didn't have any idea that I could transform that much type of result. And if you don't have like a major life altering pain and dysfunction, then really tackling, your mechanics is usually going to do the trick.
Mhm.
But there's things that you need to have on track with your mind, energy, emotions, which I know you're an expert on, Natalie, as well as the nutrition. And so I can't go forward too far into the mechanics unless we at least quickly,
Yep,
because
let's
I
do
know,
it.
let's quickly address the mind, energy, emotions. Basically, you got to love yourself. You can't go to work out and think, I'm not good enough, I'm in too much pain, I'm overweight, I'm whatever, and hold that stuff in your mind, or think of this like no pain, no gain. And then, like, basically, you're training your body to go through pain and exercise. That means you're training your neurological system to have pain in it. How
Wow.
well is that going to work out for you over years? So basically, in the mind, energy, emotions stuff, in 60 seconds or less, that's what I would share. On the nutritional side, you got to follow an anti-inflammatory diet,
Mhm.
especially if you're not, especially if your metabolic conditions are off. You have to have your blood sugar regulated, not being eating a bunch of processed carbs, dairy, wheat,
Mhm.
gluten. These things for most people make a huge difference.
Yep.
So optimizing those, and then we get to talk about biomechanics
Yeah.
after that.
Okay, before I get into the biomechanics part, because I got a lot of questions about like knees and hips and back and all of those things. If somebody hears this about the mind body connection, I know you and I are on the same page here, but some people roll their eyes at it and they're like, what do you mean? I can't think away my feeling overweight, or I can't think away my really bad knee pain or my injury. What do you want that person to know?
I want you to know that you're right. It's not going to just happen overnight. You've trained yourself into your current condition, and to train yourself out, you're going to do the same thing, but in the positive direction as you've done in the negative direction. So positively, what does that look like? Taking one exercise session at a time. If you're what Natalie just explained, you're not an individual. That's going to be a good idea to go and do exercise that's painful, that you dread, that you don't like, and like push yourself through hit circuits and all this stuff. That's a horrible idea. I don't care
Mhm.
what the YouTubers are telling you. That is a horrible idea.
Yes.
What you need to do is really simple. Like, you should start your exercise session with a meditation, is self-love and connecting, and like starting to process your emotions of in the negative out and the positive in. And no, it's not going to happen in one day, but if you repeatedly do a process before exercise to get your
Mhm.
parasympathetic nervous system activated and start quieting your sympathetic nervous system. So, really quick, you have something called the autonomic nervous system.
Okay.
And many of you have heard this possibly before, but the parasympathetic nervous system is rest and digest. It's the calming activation of your body, basically. And the
Mhm.
sympathetic is the opposite. Most of us are running around with way too much sympathetic nervous system stimulus because of stressors, because of diet, because of lack of sleep, because of you name it, because
Yep.
of potentially body pains you've gotten yourself into as well. And when you activate parasympathetic, by calming and relaxing, you're going to have way better results. So, in exercise, you have a very prolific, profound way to change the way you feel and function, because you're truly practicing mind body retraining.
Okay.
And so, when you're exercising, you should be exhaling the negative emotions or thoughts that are coming into your head, and whatever you think as the opposite. So, I'm overweight. I'm not where I want to be. Look at all this flab on my abdomen. My knee hurts. All okay. So exhale that. And what would you inhale instead? And it might start small.
Yeah.
But long story short, what will happen is if you start to attach some emotion to the inhale of the positive emotions, over time, you will become an expert on retraining your mind for that if you keep staying consistent with that retraining. So you will literally retrain the way you think and you feel. And while doing this during exercise, you're training these things into your mechanics. And so now all of your tissues and your body to mind connection are learning that you feel good, you function good, you're connecting with positive emotions. You'll begin to retrain your subconscious, and you'll literally retrain feel good sensations into your body tissues.
I love that you share this, because this is a really interesting thing we figured out we have in common about what we teach. Because when I teach nutrition, I start with that mindset piece of being really clear on what you've decided for yourself, what you want for yourself, and what you like about yourself. And a lot of women look at me like I'm crazy when we start with that. But it's the same reason you're maybe rolling your eyes at Robbie right now, if you are. But we know that this works, because when you do approach things with this isn't going to work, or I hate myself, or I don't like it, you're just basically reinforcing that. And like you just said, Robbie, that makes a lot of sense. You go exercise with that wrong mindset, you're reinforcing these bad beliefs. It's not, you have the wrong foundation to start then. You have the wrong foundation to start.
And I'll tell you, you know what's even is really interesting for you, the individual listening to this, that might be like you really see some light at the end of the tunnel all of a sudden. Let me give you even more encouragement. Let me
Okay.
share this with you. Pretty much every super fit person I know
Yeah.
who's done what I call just hardcore constant, consistent knucklehead training, which is like prescribing to, or subscribing, I should say, to all the like high intensity stuff, which has its place, yes.
Yep.
And if you're currently unfit, not the time for you.
No.
And so what happens is they're consistently train themselves with pain. They literally, I don't know anyone that doesn't is pushes like that and hasn't had a lot of body issues
Mhm.
as a result, because once you start to think about it, it's like obviously like you're training your nervous system while you do physical activity, and your nervous system is part of your mind, your energy, and your
Mhm.
emotions. You're training yourself for how you want to function. So if you're pushing yourself through pain, although that's like the thing that everyone subscribes to for like having higher level fitness, that's not the way to do it. I'm here to
No.
tell you, I've been there, done that, trained hundreds of people to do that. And I know all of the best who have also trained hundreds and
Yep.
thousands of people to do that. And a better way is approaching yourself like we're sharing here, with love, care, connection, finding comfort. And this is actually what I call, is we have a 3 filter process to improving fitness functionality. And the first filter is what Natalie and I are talking about right now. And that's
Okay.
filter 1, where you're introspectively mind, energy, emotion retraining so that you have functionality being built into your performance. Because what most people do is they have dysfunction in mind, energy, and emotions and
Mhm.
mechanics, which we'll get to next. And they go and they start focusing on what? Performance,
Mhm.
sets, reps, how much should I do? How long should I do? All
Yep.
these kind of things. And what happens is they build dysfunction into their performance. So they're increasing performance, they're getting stronger, they're getting better endurance, they might be losing body fat, but simultaneously, they're getting a tremendous amount of negative results, which will come back ultimately to bite them in the butt. Okay.
Yeah.
So that's
Makes
on filter
sense.
1. Yeah.
So we have to do that part first, even if you're thinking you don't want to. This is the critical component. And I love, and it just feels better to be starting from that place. Honestly, like when you start training yourself to do that, I know that when I do my workouts now, I would say the first probably 20, 30 minutes is not just like a warm up of me going through motions, but it is me thinking like you're talking about. Like, even if I didn't really connect that until you said this, it really is. It's focusing on what I want to create, how I want to feel versus like, oh, I have to do this and it's going to hurt. And it's that, and it does make a big difference. It really does. It makes it very intentional. I want to talk about some physical things I know people are going to want to know. Like, okay, so let's about knees to start. Why do knees seem to be hurting in so many people in midlife?
Well, thank you for that question. And that gets us into filter 2, which is what we call mechanical optimization or biomechanical optimization or body alignment.
Okay.
And why are knees hurting for so many people? And the answer depends on the individual. But if we look at like any 1,000 people that really have knee
Hmm.
issues, that weren't like hit by a car,
Right.
even in this case, they can end up falling in the same bucket here that I'm going to share. But they have body misalignments and they have
Okay.
tissue functionality that's not working how your body ideally was designed. So, just like the immune system, so the immune system's job is to find foreign invaders.
Hmm.
And when they find foreign invaders, they attack it. Your nervous system and your somatosensory system is to find body dysfunction, also amongst its other key aspects, and to find, oh, this part's out of alignment or this tissue isn't working the way. And it creates pain signals to help
Hmm.
teach you to move into the right position. And also, what happens is, mechanically speaking, because your body's not aligning properly, it causes shear stress in your joints. And the knee joint is specifically designed to be a hinge joint. So imagine a hinge on a door. The
Okay.
door opens one direction and closes one direction. That's basically what your knee does. It's a little bit more complex than that, but 98% that's about what your knee does in terms of functionality. Hinge joint. So when your feet are dysfunctional, which in
Hmm.
extreme majority of human, period, but especially female feet are dysfunctional because of the casted
Yep.
footwear that they use and change their toe alignment. So they start to lose toe splay. And when you lose the separation of the spacing between your feet toes, you lose the functionality of how the foot's supposed to ideally stabilize. And the foot starts to move in positions that it shouldn't, such as pronation or rolling inward and creating
Okay.
bunions and hammer toe toes and all these things that are really common for people, especially women. And so those mechanics and those dysfunctions go up the chain to the knee and they cause shear stress, which means shear stress is like, well, first you need to understand there's two types of mechanical stress primarily:
Okay.
compressive stress and shear stress. Compressive stress is like where the knee, the thigh bone connects to the two lower leg bones and they compress. Just like if you were to put your hands together, they compress. Shear is like if you rubbed your hands across each other. So now what happens is the knee for most people starts to shift inward because of the foot loss of stability. And then so that causes excessive stress in the knee, which creates things like meniscal tears and other tissue breakdown within the knee. And so you're feeling the pain and dysfunction from that. And the other thing that happens for many females, especially, is their pelvis is wider than their knees for almost like all females.
Right.
Pelvis is wider, especially than a male. So that's a Q angle from the hip to the knee is a
Yep.
sharper angle. And so this angle also leads to the knee falling inward with misalignment. And so then most people don't have well-developed butt muscles. And so because the butt muscle is not stabilizing, that is the key muscle that stabilizes the knee. The thing that stabilizes the knee mostly is the hip muscles, not actually the knee muscles. Yes, they're important, the knee muscles, but the hip is even more important for knee alignment. And because of Q angle plus weakness in glute medius, especially hip muscle, that leads to the knee also falling inward. So when you have all these different dynamics of the knee not being a hinge joint, then you
Right.
start to get shear stress. And this is what causes breakdown and pain in the knee. And then when you have an inflamed body, because you don't have a good mind, energy, emotion, and nutritional habits,
Yep.
your whole system is more inflamed. So then your whole system's going to find that mechanical irritant and make that be the area that becomes inflamed.
Okay. So as you're saying all this, I'm like, okay. There's all these different layers. So where does one even start? And when you answer that question, what goes wrong when someone just says, oh, you know what? I'm just going to do like a cortisone injection to not feel it and tough it out. Or they go even more extreme and say, oh, I'm going to do a knee replacement. Or they go the complete opposite direction. They're like, I'm going to wear barefoot shoes and I'm just going to start like, talk to us about kind of like the quick fixes people try to do. And then like, what's the right way to actually fix this?
Yeah, so let's make sure we comment on cortisone quickly.
Quick
And
look, cortisone, knee replacement, and then the other extreme when we just go to like, I'm going to do barefoot shoes.
okay, well, that's another. So let me
Okay.
go
Okay.
cortisone and knee replacement. So a lot of people I call like the cortisone people like lotions and potions. We all
Okay.
remember that store, like we're gonna buy this thing or do this thing that's gonna have this magical cure. Usually the magical cure
Mhm.
is what people don't want to accept because it usually takes some work and it's inside you. You're walking around with $1 trillion piece of equipment that's absolutely phenomenal, better than every AI we have right now. And
Yep.
if you just take care of it properly. So a cortisone shot, what does it do? It changes the regeneration cycle of your cells. So it decreases inflammation. You need some inflammation. Cortisone comes in, completely almost shuts off the inflammation to the area. And so if you don't have breakdown, you're not going to have regeneration. So most
Mm.
people, their tissue, where they have more than one cortisone, especially, it starts to become like tissue paper, fibrotic scar tissue that's no longer healthy, functional skeletal muscle structure, which is going to make you very weak.
Wow. So that's why they say you shouldn't do more than X amount or whatever it
Exactly.
is. But it sounds like
Exactly.
it's just a band-aid. It's just taking the inflammation away
Yeah.
temporarily.
Yeah, and it does help because it's a great anti-inflammatory, but
Hmm.
where are you going to be at in the future? So if you want to have a better life, better body, better quality of life, live your best life, you should always be being the butler for your future self. So what do you do now so that the future continues to get even better? It's
Yes.
certainly usually not cortisone shot. It's optimizing
No.
your mechanics and your body functionality. Knee replacement.
So before you say knee replacement, so the cortisone shot, I would imagine would have a place if like you're an athlete and you need to do it for something that's like temporary or something like that. Would you ever think there's a time for it? Like you're competing in something. I would imagine that would be where it
Yeah.
would ideally actually be used.
Yeah, Yeah,
Okay.
exactly. And I have a lot of friends who are like ex MLB, Major League Baseball, ex NFL, and
Okay.
their body is like wrecked
Yeah.
because of these cortisone shots, because that's what they need to do to stay in the game. But most of the people, which is interesting, Natalie, because a lot of these hit training and like
Hmm.
this method and like tax your muscle more, maximum
Yeah.
muscle gain. And then on the bone density people, it's, hey, you're going to plyometrics and high
Yeah.
force is going to build your bone density. Okay, well, first of all, you're probably, if you're having bone density issues, most, not all, but most people,
Yeah.
you're in no mechanical condition to be doing high velocity, high
No.
force. So we have to apply these methods, the right tool to the right situation. So that's why I specialize in people over the age of 50 or close
Hmm.
to the age of 50, because there's amazing science that can be applied if you do things in the right way. So yes, that could be right for an athlete that might have the most lucrative part of their adult career money earning life.
Sure.
And it's worth them getting some fibrotic tissue in
Makes
some areas
sense.
of their life to make an extra few million, right?
Yeah.
But that's not most people's case. So I would strongly encourage them to make a more intelligent choice. And so, like, okay, so knee replacement quickly on that. Here, think about this. If your car is out of alignment,
Hmm.
and due to that, the position of the tire on the road is wearing out the tread on
Mm.
the outside or
Oh,
the
I see where you're
inside,
going. Yeah.
you're going to
Replace your tires,
replace
but
the
you'd
tire.
also, but you should align it too. Right. Makes
And
sense.
that tire replacement, yes, ma'am. And that tire
Uh-huh.
replacement is synonymous with the knee surgery, the shoulder surgery, the back surgery, the hip surgery. Great.
Wow.
Tire, you're good to go. But guess what? Your alignment is still out
Wow.
because you ended up there because of lack of good body mechanics that wore out your joint. So now you still have the weakness, except for now you went through a surgery, which is major trauma on your body. Yes, it helps
Totally.
improve. Yes, it fixed things, but it's a lot of trauma.
And
And
it's
so
temporary. It
the
sounds, yeah.
research on these big surgeries and most surgery is usually people get back upwards of about 50% of the functionality they could have. Usually
Mm.
it's about 30 to 50%. So if you're optimizing your body mechanics, your alignment, your tissue functionality, you're going to get fully functional. And here's what happens is we have specific positions, a spectrum of specific positions, alignment, functionality we should hold our pelvis in, the way our feet should move, the way our knees, shoulders, back, spine, everything. And when that alters towards misaligned, you're training your tissues to basically be strong in misaligned positions, which ingrain excessive wear and tear on your body. But if you train the mechanics of your body to be ideally aligned, it's going to significantly reduce the amount of stress that's placed on your body as you age.
Hmm.
So as you're exposed to more degeneration and inflammation with age, your body's going to have less of that mechanically because you're
Yeah.
ideally functioning. And then barefoot shoes. So then, oh, I'm gonna go like extreme with this
Yeah.
body alignment, mechanical optimization. You're almost thinking in the right direction, not quite. So if your feet are not used to being in a barefoot shoe or a foot shaped shoe, these type of things, which are great for your feet, you're going to all of a sudden add a significant amount of new stress on your
Yes.
feet, on your calves, on your body mechanics. And so I strongly discourage people to like just jump to a barefoot shoe because very likely you're going to develop different forms of injury and excessive wear and tear unless you do a very intelligent step-by-step progressive process towards improving your functionality.
So it's like in an ideal world, if you had always worn them, it'd be amazing because like you've always walked that way, right? Like so if you from the time you were a kid were in those types of shoes, that would be supported. But if you've not done that and now you've got these issues and you just go to that, you're going to create almost other problems. So it has to be
Yes.
gradual. Yeah.
Yes, and really quick, so on that, 5,500 people studied, China and India, these were barefoot populations, and what they found was like bunion. Nobody
Wow.
had a bunion who was
Wow.
barefoot because they grew up with that. And all these
Yeah.
feet issues that we have, there was like max of 1.5%, whereas like we have population that has upwards of like 50, 60% of
Yeah.
the people have some of these feet issues.
Wow. But yeah, I that is something that I always will when people go to those shoes right away, I'm like, I get the point if you've been doing that or if you've worked to do that, but just to go right from I'm wearing these big wedge shoes to doing that, that's going to create more damage right away. So interesting how we we're always looking for the shortcut, right? So you're like, you jump to the conclusion, oh, well, that would prevent that. So therefore we should just go do that all the time. What
Yeah.
about when people tape things? So like you see somebody who has a knee pain and they're going to wear like a splint over it, or they're going to tape it, or is that doing anything?
Let me share the research with you quickly, and this what I share in the research will apply to all.
Okay.
Should I brace it? Like, should I brace it and or guard it? So they did their research on Home
Mhm.
Depot workers, and they had
Okay.
one group of Home Depot workers wearing the back support during work and one not. And what they found was the incidence of injury on the people who wore the back braces during work had less injuries during work.
Okay.
And then the injuries that they had
Mhm.
outside of work surpassed
Wow.
those that didn't wear the back brace during work. Conclusion, by wearing a brace, it's an artificial external support
Wow.
which will weaken your mechanics so that you're less stable and less injury proof.
So good. Yeah, it makes sense.
So the when should you? The time you should wear bracing is when you're going to be doing something that's significantly outside of what your body's currently used to or adapted to do. So those who choose to do heavy strength training and back squats and this type of thing, if they're going to do, for example, someone who's really serious in strength training might do 6 or 7 sets of
Yep.
squats. Well, the sixth or seventh heaviest set of squat, good time to wear the back belt. First 4 or 5 sets building up, bad time to wear the back belt.
Makes total sense. Okay. I still have so many more questions for you, but all those listening, you're probably understanding why I have Robbie on now. He's just so knowledgeable when it comes to here. Depending on when you're listening to this, he is doing something super epic. He does this 4 times a year. I think you mentioned 4 times a year. So,
Yes,
so
yes,
depending
ma'am.
on when you're listening to this, hopefully you can still get into this. He does a free challenge, which we'll explain more later, but it's a free challenge where he really dives deep into a lot of this over a week. It is totally free. If you go to, and I'll put this in the show links too, but if you go to midlifeconversations.com/fit doc, like FITDOC. So midlifeconversations.com/fit doc, DOC, that will help you save a spot in the challenge. If the challenge is over, I'll have it redirected to something else where you can get help with Robbie, but I wanted to just make sure I got that in before we keep going. Okay. So that's knees. I'm assuming you're going to say kind of a similar answer to ankles and hips, but I want to ask about that because knees seem to be the most common, but then we hear ankles and hips.
Just really quick on what you
Yep.
just shared. So what you just invited people to, I go through their whole body. So
Oh,
all these
wow.
things, I literally show them. Here's how the foot and ankle should ideally function. Here's knees, hip, back, lower back, pelvis, shoulders, neck, like the whole
So
body.
you have a guide to compare. You like
And
know.
then and then I show them how to look at their current functionality. And then I show them exactly what to do to improve their alignment and their functionality. So if they're a couch potato, this is awesome because it's very approachable body alignment, approachable
Wow.
body. If they're super fit or anywhere in between, also awesome for them because they're currently causing a lot of havoc to their body that they could be preventing and improving the mechanics on.
So good.
Yeah.
So good. I've got to do it. I know I've got a lot of stuff to learn there. So I'm in. That's awesome. Talk to us about ankles and hips. What's happening there?
So ankles and hips, so feet, ideally within reason, they should be stable. Okay. And then when you go up a joint, and the ankle should be mobile. And then you get to knee, it should be stable, stay in a hip
Okay.
strength. When you get to hip, it's mostly about mobility.
Okay.
So ankles and hips, the thing that's synonymous in terms
The
of kind
mobility.
of thing you're trying to optimize, it's very important for them to be stable too. It's not that it's not, it's mostly about mobility. So a lot of people lack what's called in the ankle dorsiflexion.
Okay.
Simply what this means is when your foot comes towards your shin,
Yep.
forward towards your shin. Okay, so top of the foot coming towards the shin. This is dorsiflexion.
So opposite of wearing high heels.
Yes, exactly. And so that's one of the major causes for females,
Yep.
especially. Males have the same thing because a lot of males have heel lifts in their shoes. What happens is because the backside lower leg tissues get restricted, you're not able to dorsiflex as much. And when you can't dorsiflex, so this is like
Yep.
front back movement pattern. When you run out of ability to properly do front back movement pattern, you're going to go into one of the two other movement patterns. And most of the time, in this case, it's the side to side. So that causes the rolling in of the ankle because you run out of motion in
Yep.
one direction. And then this causes issues in the knees. So like if we're, we could go on all day talking about little details about the ankle, but like the one big thing that makes the biggest difference in ankle is you want to have really good dorsiflexion. So
Okay.
calf stretching within within reason. Again, don't
Yeah.
like go like jump in the deep
I'm
end
literally
first.
stretching my calf as we're talking right now. Like I,
Awesome.
because you said that. I'm like, okay, got to work on that.
So dorsiflexion is really important. And then when you get to the hip, there's multiple planes of motion that are really important. It kind of just depends on which one are you deficient on. When you get to the
Hmm.
hip, it's more of like which one are you deficient on. So the hip primary ranges of motion, internal. So the femur bone will rotate inside, the femur bone will rotate outside. The femur bone will come towards your chest. The femur bone will go away from your pelvis and chest, torso
Hmm.
area backwards. That's extension. And kind of wherever you're most limited is really where you're going to want to optimize. So, like, for example, one of the things we do in the event you just shared, we actually look at all these ranges of motion and help you see where you're at currently. So, the thing about hip motion is you want them to be symmetrical, left hip
Hmm.
capability to right hip capability. And you want it to have a good amount of rotation because the lumbar spine going up the body, the next chain, the lumbar spine, if you look at the mechanics, and it actually, Natalie, if you want me to, I could grab the skeleton and
Hmm.
literally show. Okay. So for those of you that are only listening to the podcast version, I'm showing my good buddy here, Johnny Bones, which is a full size, life-size skeleton. And now we're going to look at the lumbar spine.
Okay.
And so as we come to the lumbar spine, what happens is, so if the hips don't have good motion,
Right.
rotation, what happens is the lumbar spine will start to, and apologies for the change of audio here, guys. So the lumbar spine will then rotate, like if I'm going to turn and I don't have good hip
Okay.
mobility, I'm going to move my lumbar spine.
Right.
So if you look at the facet joints, you'll see the facet joints have a bony block. So this bone runs into this bone. Your spine is literally designed to have a block. So you can see mechanically that the lumbar spine is not designed to have a lot of rotation ranges of motion. But a lot of people, for example, with their training, they don't respect that. And they develop a lot of lumbar issues, which is why the number one way to injure the lumbar spine is picking something up off the floor
Okay.
while doing rotation with your lumbar spine, because you're bending your spine while you're
Right.
rotating, and
Wow.
that tears the disc because you can tear the disc. And so in the research, what we see is those who have greater than about 3 degrees per bone disc bone interface, they will have significantly more pain and dysfunction in their lumbar spine. So you actually want to have less rotation in your lumbar spine within reason. Some is good, more than moderate's not. And then, as you go up, really interesting point while you're understanding this is as you go up to the thoracic spine is the opposite. I know it's a little bit difficult to see in the video, but
Mhm.
basically what you're seeing is the facet joints are now designed with a sliding element so that they
Okay.
slide over each other. So now you would immediately know that the thoracic spine is absolutely designed for mobility and you want
Right.
to have good rotation. So mechanically speaking, if you want a good structure, you want stability, then mobility, then stability, then mobility. And so as we look at the skeleton, you'll see feet stable, ankle mobile, knee stable, hip mobile, lumbar spine stable, thoracic spine mobile. And then when you get to the shoulders, that's where it really gets tricky. It's the most easily injured joint in the body. You actually want both stability and mobility because of the huge ranges of motion that the shoulder has.
You know what's coming up for me? This is really an interesting analogy I just thought of. So, in fat loss, in weight loss, people a lot of times will say, how do I lose weight in my stomach? Or how do I lose weight on my thighs? And our answer is you can't spot reduce. You have to lose overall and strengthen overall, and then we can make a difference. Like, right, we would say that. Like, you can't just spot reduce your stomach. You can't spot reduce the back of your arms. What's coming up for me is it's almost the same thing with correcting an injury. You can't just spot correct where you're feeling the pain. If I'm hearing you correctly, like really, wherever you're feeling the pain is kind of like the result of the imbalances from the other areas. Am I saying that right?
Yeah, and usually the place of the pain is not the cause of the pain. Yeah.
Right. So like if I said I want to spot reduce my stomach and I'm going to just tape my stomach and like make like wear Spanx all day long and just make it in, I
Yeah.
didn't fix the problem. I just maybe made it look different. So when you treat pain on the hip or the knee or wherever you're feeling it, and you're just targeting right there without looking at the whole body, it's kind of like spot reduction in fat. It's what's coming up for me, that you really have to look at all the mechanics.
Yes, I would tell you, hey, go see Natalie Jill to reduce your stomach size and do the right nutritional mind protocol, and then come see us to build your booty and your hip
Yeah.
muscles. And now you'll really be cooking with awesome
Yeah,
shit.
you do it all together. But it's the whole
Yes.
approach. You can't just say,
Yeah.
my knee's hurting, I'm just gonna go get a replacement, or I'm just gonna tape it, or I'm just gonna inject cortisone. Like I'm hearing this. Like you have to really look at this. I'm gonna bounce up to a whole nother area because this is super common in menopausal women. You might know what I'm gonna ask, but this is tends to correlate to drops in estrogen, but frozen shoulder. What can you tell us about frozen shoulder? Where is that coming from? And can we even fix that? What is that?
Yeah, so the humeral head here, so this is the
Okay.
humeral head, the top of the arm bone. And what happens is they also call this capsulitis. So so you have labrum that surrounds the humeral head, and then you have the glenoid of the shoulder capsule here, and basically the tissues get really adhesive
Okay.
and they start to get stuck. It can be because of some inflammation, but the capsule of the shoulder is becoming inflamed, hence the word capsulitis.
Mm,
And so you start to lose range of motion. A lot of times, this is with people who are doing repetitive motion or not, of course, usually never by, I say never by choice, but they're not respecting the mechanics
sure.
that their body should be doing. So they end up losing ranges of motion. And a lot of people, like, for example, there's a lot of people who exercise who think they should be doing all this overhead motion. There's an entire science body
Mm-hmm.
for working with people that are choosing to do a lot of overhead motion because it's so damaging for your body that we had to
Wow.
develop a special whole
Wow.
branch of science just for swimmers, baseball throwers, and all these people who are very commonly get overhead use injuries. So
Wow.
the shoulder is the most complex joint. It has to be one of my
Mm-hmm.
favorite because of that. And quite simply, if you keep the front side of your upper body mobile, so
Mm-hmm.
all this area around your chest,
Mm-hmm.
your lats, which come up here and attach into the humeral head and have a tendency to roll your shoulders
Mm-hmm.
inward, if you keep this area mobile and you keep the back area strong, you're almost all the way there to having
Okay.
great shoulder functionality. I'll add a little bit more, but the same things I'm sharing are the same kind of things that from a functional standpoint could really help redevelop your shoulder. For frozen shoulder capsulitis can also really help anybody not have shoulder issues or who've had shoulder surgery and any number of things. Like, this is the approach. So you want your back to be really strong. It's actually much more important than your chest to be
Yeah.
strong. And look at the design of the human body. So the scapula, right? So the scapula is basically
Mm-hmm.
floating here in tissue. Between the scapula, which is your shoulder blade, there's
Mm-hmm.
no bone connection back here. So the only thing that creates stability between your shoulder blades is all the muscle tissue. The rhomboids, the trapezius, the lower trapezius, all these tissues that connect.
Yep.
There's many others, which I won't get into a full
Mm-hmm.
anatomy lesson here. The point is it's really important for your back to be strong because the bone attaches to the connective and soft tissue, muscle tissue. Whereas if you look at any other bone, pretty much every other bone in the body is all bone to bone connections. And so it creates the stability because of the bone to bone connection. The scapula doesn't have that. So
Right.
another thing for most people to know is a lot of people will, oh, I have tension in my back. I have a knot. So I go to the massage therapist. That's like one of the worst things to do long term.
Okay.
Short term, you're going to feel why? Because here's what happens. The shoulder starts getting pulled forward, and then
Right.
you get a knot in the back. This is really common
Okay.
because this is being pulled on. So if I walked around and did this to you for even
Yep.
10 minutes, let alone like all day, every day, you're going to get tension in the back because the back is consistently
Right.
pulled on. So then they go to a massage therapist and they get massage on the back, which then makes the tissue even more relaxed and even weaker and actually causes even more of an issue. When really
Wow.
the massage therapist should be focused on massaging the front side. And they might even just be able to, the client might not like it because everyone's thinking that the problem is exactly what the
Yep.
problem is felt. So if they were focusing on the front side upper body, that would help mobilize the shoulder and make the actual causation go away where they don't have that issue anymore long term.
Wow. So I want to add on to that about, I'll be careful here because I don't want to upset people, but with chiropractic, what would you say? Is that helpful? Does that just feel good? What are your thoughts there?
I actually love chiropractic when it's like everything, right? When
Hmm.
it's applied in the right way. I love chiropractic. I think
Okay.
chiropractic can be incredibly helpful. Our nerves and our central nervous system is what connects to everything else in the body. And if you
Hmm.
don't have good nerve conductivity and flow to the organs, the tissues, that can drastically affect the health of your body. So having those what they call subluxations, pressure on the nerves relieved, can really be helpful. So, really responsible, ethical, highly educated,
Yeah.
skilled chiropractors can make a gigantic difference in your life. The one thing I would really say though is a lot of people trying to find themselves back into this band-aid situation like the cortisone.
Yep.
Chiropractic, I would see being drastically more healthful and holistically beneficial, of course, but your bones don't move on their own. So, like we're adjusting the bones with chiropractic and the joints and
Hmm.
everything. And if I had that, Johnny Bones is never going to move.
Yeah.
So I hope he doesn't. That would break me out.
That would freak you
But
out.
the point being, your body moves because of your soft tissue, because of your nervous system, connection with all of your muscles. So, if you want to align your body and optimize the functionality, you have to start in the mind, in the brain, in the
Mm,
higher centers of the brain. And so, you will feel 20 years or more younger when you understand your body motion and movement as a skill, because for you to do that, you have to retrain the higher centers of the brain, which is where all this processing begins. Those messages go through the spinal cord and then go to the peripheral body structures. When you understand how to move ideally, position, align, function, then that will naturally train your spinal cord connection with the body. And then now you start to change the
mm.
mechanical characteristics of your body and you're literally reprogramming. So anything that focuses external or little quick fixes and band-aids and braces and all this stuff,
Yep.
you're never going to optimize the root. So all people that do those things say something along this lines. It was really helpful until, or it's really helpful for a day or a week or some very short time period, but it doesn't stay. And the reason
Mm.
why it's not staying is because you're not working from the foundation of the functionality of your body.
Makes total sense. I have one more area I want to ask you about, and then I want to talk a little bit more about your challenge and who this is for. So, I have shared publicly many times about L5S1 that I had a disc rupture there. So, my theory, and I'm going to tell you my theory and what I'm going to share what my knowledge to be up until now, but I want, if it's not accurate, don't worry about correcting me. Like, I want to hear what I should know. So, I've had this belief that disc generation can happen as we age, that all of us could have disc generation. Some of us feel it, some of us don't. In my case, I had disc generation like a lot of people will, and I was overtraining, which we talked about earlier. I was actually on set years ago and I was doing like 9 hours of intense stuff I shouldn't have been doing. And my disc ruptured out, like full ruptured out, where I had foot drop, leg stopped working. I was like literally dragging my leg. It was a whole thing. And I had an emergency laser surgery just to remove the ruptured part so I could get used to my right leg back. I did not do a disc replacement. I did not do a fusion. And I didn't do either because I figured if you do that, then I would create other issues in my body. So what I learned to do instead, what I realized was that I had a very strong ab core area, but I had very weak glutes. I had really overlooked glutes. So what I learned is, well, if I'm going to not feel pain between L5S1, which a lot of women have L5S1 pain, a lot of them do from wearing heels, from sitting a lot, just all those reasons, that if I wanted to take that area out of the equation, I really would need to develop glutes. And the stronger my glutes are, tied with my core, so that whole area, then I would almost take L5S1 out of the equation and not feel that pain. So till this day, if I sit too much or if I'm not training regular, like if I get off track, I will feel lower back pain. But I've been able to manage it by standing more than I sit, stretching hip flexors, training glutes. So I wanted to share that first because that's kind of what I've been teaching around lower back pain, but I want to get your thoughts. Is that correct? Am I missing a component here? What do you want people to know about lower back pain, especially women? They talk about it all the time.
Yeah, you're absolutely right. There's
Okay.
nothing that I would disagree with. I would, to take it a step further, it's,
Mm-hmm.
well, what are you missing? Like,
Mm-hmm.
do you have mobility restrictions? Do you have, for example, those who have limitation in internal hip rotation, their hips don't rotate internally very much.
Mm-hmm.
One is usually because of a pelvic alignment factor, which can be helped by the
Totally.
glutes, but it's very common to couple with lower back pain.
Hmm.
Um,
Hmm.
and so, especially like in golfers, because they
Yeah.
don't have good hip mobility and rotation. We talked about this. Core and breathing, I would say the biggest things that I see, yes, glute activation, huge. Interestingly, I would say breathing is
Hmm.
one of the number one thing, like obviously we're all
Like,
breathing or we wouldn't
yeah.
be here. But proper breathing, proper diaphragmatic breathing, and
Hmm.
understanding how to hold your posture, and something called costo, which is your ribs,
Yep.
and pelvis alignment, the way the pelvis and the ribs. So a lot of people look at pelvic alignment, but you want to have the proper rib alignment too. So all this to say that if you have like a really tight psoas, or you have some
Hmm.
specific glute muscle that's not firing the way it should, or if you have a rounded upper back,
Yep.
some people have a flat lower back, some people have an excessive arch lower back. All of these things can cause an issue. And yes, glute functionality is a huge part of that. So I think you're absolutely right, but there's more
Yeah.
pieces to the puzzle. Someone might have pretty good glute functionality, but they're really missing somewhere else, and that could cause
That
significant
makes sense.
back pain.
I will say most women, again, I'm generalizing, but most women I see come through my stuff that complain of lower back pain, they do not have glutes. Like they have, I call it the grandpa butt, like the flat. So just when I started making that connection, I'm like, okay, just even being able to do a glute bridge or being like just getting some mobility there, some strength there can make a big difference. And then also standing more than you're sitting, like doing these counter things. Robbie, this is so good. Tell us more about your challenge. I know I talked about it a little bit early on. If you all go to midlifeconversations.com/fit doc. So midlifeconversations.com/fit doc, DOC. You, depending on when you're listening to this, you can save a spot in his free challenge. They do these quarterly. Tell us what they can expect. I know you do it over a week. It sounds phenomenal.
Yeah, and I would love to share one other thing that
Yeah,
we that your listeners
please,
could have access to.
please.
And so if you go to the fitness doctor, all spelled out, so the fitness doctor,
Hmm.
just like you see here,
Yep. And we'll link below too.
thefitnessdoctor.com, you can schedule a
That's
consultation.
even better. Yeah.
Yeah, you can
Amazing.
schedule a private consultation. So like if you're listening to this and you go to see our event page and it's not for like 2 months, and you're like, I really want to meet with someone.
Yeah.
You can meet with me directly or one of my clinicians. And by just going to our site, and there's a tab
Amazing.
there for you to schedule a consultation.
And you
Uh,
can even do both. You can do the challenge
yeah,
and you can do that. That's
yeah,
amazing. I
exactly.
love this. I love this. So, okay. So tell us about this challenge. I know you do it. I mean, I was asking him a million questions about it and I love how you do it over a week, right? It's how does this work?
Yeah.
And then,
Yeah, so it starts on a Saturday and we do this 4 times a year. And whenever you're listening to this, you would just go to the link that
mhm,
Natalie shared, and then you would see when the next one's coming.
great.
And it's a 5 sessions. So it's 5 sessions. It starts on a Saturday and it goes Saturday, Monday,
Okay.
Wednesday, Friday, Saturday, 5 sessions. We have 3 different time of options for each day, same session. We
Amazing.
make it really easy for you to attend. When you go to the site and you schedule yourself in, you'll start getting notices once the event is coming. And as I shared in today's episode, we literally go through almost your entire body: foot, ankles, knees, hips, back, pelvis, lower back, upper back, shoulders, neck. And I'm literally looking at how should your body ideally function and helping you to see where you're at now. For
Hmm.
example, like the hip mobility things, I literally show you how to do those hip mobility
So
tests.
good.
And then we match, like, okay, if you had deficiency there, do this. If you had deficiency in body alignment here, do this. And long story short, here's what people walk away with. Regardless of if you're currently a couch potato and you're looking to get off the couch, or you're like an elite athlete and you just want to stay
Hmm.
super functional and fit and young forever, it's good for everybody. So you're going to walk away with being able to understand where movement and the foundation of movement starts, which is in the higher centers of your brain. You're going to understand your body alignment, your positioning,
So
so
good.
that when you move throughout your daily life, you're much more aligned. Or when you do exercise, you're doing it as a skill and not a mindless activity anymore. And all these things that we talked about in today's episode and much, much more, you're going to be able to apply to yourself in anything you're doing, whether it's daily movement or exercise.
So good. Thank you so much, Robbie, for doing. I know when I asked him to come educate my audience, like, well, we have this challenge. I'm like, I know, but I still want to do a deep dive episode. I want to hear these main things. So thank you so much for doing this. I will link below on how to do his challenge, but also how to consult with them directly if you want to have like a personal conversation about yours. Thank you you so much for being here today. Thanks everyone for joining in.